Good morning. Welcome to the Blue Water Area Chamber Breakfast Brief, part of our business education series. Today we have Jenny Hayes from the Visiting Nurse Association and Blue Water Hospice, located in St. Clair County, specifically in downtown Port Huron. Jenny's going to talk about navigating your healthcare from home. Take it away, Jenny.
Thank you so much. Thank you so much, Joyce. We really appreciate the opportunity to talk about ways to navigate your healthcare from home, especially during this time. And we really appreciate everyone taking the time out of your busy day to listen to our educational presentation. The healthcare system can be hard to navigate, especially during this time. And our goal is to ensure that everyone is familiar with resources that are available to keep everyone's health in check from the safety of their home. So the one thing I want to talk about, we all have to be responsible for our own health. Following up on issues, getting lab work done, talking to our physician on a regular basis. So the path to health starts with us, with the patient. So how do we take charge of our health? And what do we want to do? We want to improve, obviously, our overall health and wellness. And we want to be satisfied with the health care that we receive. And during this time, we want to make sure that we stay safe with a minimal risk of exposure. And with our improving our health, that enhances our quality of life, as we all know. Without our health, what do we have? So we have to do everything we can to stay on top of our health to enhance our quality of life. And we also want to save time. Most of us are very busy, and so we want to make sure that health resources are convenient for us. Patient needs. So the role of patient has changed. Years ago, it used to be, especially during our parents' time, they just would go to the doctor once a year and just listen to whatever the doctor told them, take this pill, come back in a year, just listen to the physician. Not that the physicians didn't know what they were doing, but just now there are more resources. There's specialty physicians and mobile labs and different things available to us. And we have to advocate for ourselves, do our own research, and reach out for more resources. So nowadays there's so much technology. So healthcare services and providers can work together to coordinate healthcare for patients, utilizing technology. And as with any organization or company and anything really, communication is the key to keeping patients' health in check. So connecting with physicians. So that's really important, especially now. A lot of physicians are limiting the visits that patients can make to their offices. Even specialty physicians, cardiologists, orthopedic surgeons, gynecologists, they're really trying to limit that exposure of patients coming into the office for the patient's sake, for their staff's sake, and for other patients' sake. So there are so many different resources. So connecting with physicians, there is a wonderful app that you can download on your phone or computer. It's called ZocDoc. And it's a strange name, I know. You can download that on your phone or Google it on your computer. It is amazing. You can search for a specific type of physician. You can read the physician's bio, read reviews from other patients, and you can schedule an appointment online. It's just amazing. There are physicians in our area here in the Blue Water area that do utilize this service. You can go around and pick, say, I'm using this as an example, Jeffrey Hayes in Chesterfield, and you can read about his qualifications, and you can schedule an appointment right online. Say, I want to meet with him on Tuesday at 9 o'clock. So it's amazing the things that we can do from home. Now, they can also assist you with other things too, like other dentists and eye doctors, skin doctors, and things like that. And a lot of the visits that the doctors want to make are by video chat, and that app will actually link you to a video screen where you can communicate with your physician. So it's amazing. Again, we want to minimize our risk, especially during this time. And a lot of organizations and companies have had to adapt and diversify so that we can minimize exposure. So I work for the Visiting Nurse Association of Blue Water Hospice, and we have known since 1952, that's right, we've been around since 1952, that healthcare really is the safest option to keep patients at home safely, but especially during this time. And all our staff follow our protocols and use the proper protective equipment to keep our patients safe. Patient care providers and health services can work together. So it's all about everyone working together as a team to provide a care plan for patient and follow that plan. So we want to work together with other healthcare providers to provide quality healthcare. We want to make sure that the patients are comfortable and they have the right support. We want to screen for health issues. So for example, if a patient had skilled home care, the nurse could be monitoring for other health issues that arise and alerting their physician. Healthcare providers can diagnose, provide appropriate treatments. Healthcare providers that are coming into the home or seeing patients virtually can reduce unnecessary rehospitalizations. So we want to cut down on visits to the hospital, to the ER or admissions, unless they're absolutely pertinent to the patient's care. We want to allow for a continuum of care. So I know with our organization, we have a continuum of care. So we have private duty skilled services or private duty services, we have home health care, and we have hospice services, and ultimately, if need be, a hospice home. So it's really great that a patient, if they come into our system, they can follow, we can share information. We want to eliminate barriers for people, especially during this time. It may be very difficult for some individuals to get out in the community. They may have transportation issues. Their health could be compromised. They could be vulnerable. We want to eliminate barriers by providing healthcare resources to people in their own home. So what is important to patients? If I always try to put myself in other people's shoes, and if I think of myself as a patient, which everyone is, I want to make sure that I receive effective health care. I want to make sure I get it in a timely manner. It's convenient for me. As I mentioned, there's lots of apps that you can download and schedule appointments at your convenience. Care collaboration, working together with your physicians. And as an example, if someone had an autoimmune disease, it would be wonderful if their rheumatologist was speaking to the dermatologist to determine what would be the best care plan for that patient, what would be the best medication. Compassion, it's so important. Home care nurses, physicians, hospice care providers are all compassionate to the patient and what they do. And they provide that patient with dignity, respect in the comfort of their own home. So how are we going to achieve this? So again, we want to use the support of healthcare services and providers. We want to provide consistent communication, in-home monitoring of health, integration of technology and medical equipment. There are so many devices out there that can help us monitor our health at home. So the care team, your care team is whatever services that you require. So you have a PCP, which is your primary care physician. Then you have, if you have a stomach issue, a gastro issue, you may have a gastroenterologist. If someone has multiple sclerosis, they could have a neurologist, or they should have a neurologist caring for them. And so all those people coordinating together your care. And we work with organizations that are very responsive to the needs and preferences of the patient. So again, I've already talked about this a lot, but alliances and partnerships work the best. So we only work with the best organizations, physicians, medical clinics, and hospitals in the area that work together to provide the best care for patients in a timely and seamless manner. Community healthcare provider team. So again, what does your team consist of? Again, your primary care physicians, specialty physicians, your pharmacist is involved in that. They might catch, accidents do happen. Perhaps one of your primary care physician prescribes a blood pressure medication, but then your dermatologist prescribes a different medication to help treat a skin issue, and they do not work well together, and your pharmacist catches that. That's really pertinent to your care. There are portable diagnostic providers that can come into your home. And mental health support services. A lot of mental health counseling can be done virtually these days. Actually, majority of it is being done through telephone calls and also through video chats such as this. There's so much nutritional support available out there, and that is so key to your health, especially patients that have diabetes, cardiac issues, skin conditions. Nutritional support is so key, and there are a lot of resources out there to speak to a dietitian over a Zoom chat or over the telephone. Community partners, there are so many resources available to support, and we'll talk about that a little bit later. So technology and medical device options. Again, video calls, phone calls with providers. Most physician offices in the area are allowing that to happen now. There are medical alerts. Medical alerts are so important to people, especially I feel anyone that lives alone, regardless of their age, could benefit from a medical alert, because you just never know if someone is going to take a fall, have a stroke, and a medical alert available is so key to getting help immediately. There are so many devices, electronic pill dispensers, medication reminders. You can buy devices that will actually talk to you verbally and say, it is now time to take your medication, and or alert your family if you did not take that medication. Telehealth, there are so many devices that can screen your vitals on a daily basis to ensure that there isn't an issue going on. Some patients with cardiac issues, if they gain a lot of weight overnight or within 48 hours, it could signify that they have too much fluid in their body, and perhaps their cardiologist needs to be called to take a medication such as Lasix to reduce that extra fluid in their body. So again, we're addressing issues before they become more complicated, and we're keeping people out of the hospital and keeping them safe at home. There are digital scales that can monitor weight exactly. Of course, from home, you can kind of keep one foot off the scale and no one would know. Electronic blood pressure cuffs, really important to check your blood pressure and stay on top of that, taking any medications if you have high blood pressure. So now I'm going to talk about a scenario just to paint a picture of what resources are available out there. So I use this example. Mary is only 66 years old, but she's a widow. She lives alone in the same home that she raised her family in. She lives here in Port Huron. She has multiple sclerosis, and she's been falling at home. Her vision has been impacted as well, and she's not eating a nutritious meal. So Mary's family lives out of state, and they're very worried about her. And we're going to talk now about what would help Mary stay in her home that she loves and provide the support that she needs. Number one, Mary needs a medical alert so that she could wear it around her neck and press it for help whenever she needs it. Home health care. Home health care could be so vital to her. Perhaps when she fell, she cut her arm and she required stitches. The visiting nurse could monitor that wound for signs and symptoms of infection. She could receive physical therapy to increase her strength and muscle tone, and occupational therapy could ensure and teach her safety awareness, making sure that she transfers in and out of bed safely, and make sure she has all the proper medical equipment to keep her safe. Private duty service. Private duty is wonderful. Extra support. Maybe we need to have private duty services come in and help clean her house, spend time, companionship with Mary, help her with her bathing situation or hygiene. Private duty is typically private pay, but I just want to let you know there are grants available out there through community partners, and we can work with people's financial situation to get them the help that they deserve. Durable medical equipment is so important. So perhaps Mary needs a raised toilet seat, grab bars, and different equipment such as that. So to help Mary, we also want to coordinate with her primary doctor. Mary would be seeing a neurologist because of her MS, who specializes in treating those kinds of patients, and her ophthalmologist because she is having vision issues. Mary wasn't eating nutritious meals, which could also impact her health. So we would order perhaps Meals on Wheels or get some other kind of nutritional support for Mary. Scenario 2, Joe is 73. He lives in an assisted living community here in Port Huron. So he has a lot of support, which is wonderful. He's getting nutritious meals. He has pull cords in his apartment to pull when he has an emergency. So poor Joe fell and broke his hip. He was able to pull the cord, but he is now being discharged from the hospital after a successful hip replacement. So what's going to happen when Joe is being discharged from the hospital? The case managers at the hospital, for an example, are going to call Visiting Nurse Association and have our home care liaison come up and talk to Joe, get all of his information, and set up home care for Joe so he can transfer safely back to his assisted living community. So the home care liaison from Visiting Nurse Association would put everything in place so that he feels comfortable too. How are we gonna, well, I already did that. I'm gonna talk. So we're also going to talk about, he will need to follow up with his orthopedic surgeon. Now, Joe is going to have a wound from where he had surgery. The nurse from VNA can monitor that wound, perhaps take out his staples when it is time to do so. Make sure he doesn't have an infection. Sometimes patients have other issues that could come about from surgery, such as a blood clot or infection, and the nurse will monitor that. A physical therapist definitely will be working with Joe to recover after his surgery and make sure that he has the strength moving forward. An occupational therapist will make sure he's safe at home. He will also receive, depending on what the surgeon wants, either a walker, cane, and other medical equipment. So think of it like a puzzle. We're putting all the pieces together to work together for care coordination. There are a lot of community partners that we work with, and we are so grateful to have support from them. And that's Area Agency on Aging 1B, United Way, St. Clair County Community Foundation, St. Clair County Community Mental Health. They're all wonderful partners to us and other organizations. Community resources, I'm sorry, I skipped one. Area Agency on Aging is wonderful to provide so many various supports for seniors. St. Clair County non-emergent help, mental health or crisis line. They also provide veteran services and just wonderful. Catholic Charities of Michigan, they have All Saints Soup Kitchen and Food Pantry. They also provide mental health counseling, family support, services for seniors, just wonderful. And you know, if you call an organization thinking they provide something, even if they don't, they're going to help you and find an organization that does. The People's Clinic in Port Huron, they provide healthcare for the non-insured and so much. They do so much for the community. United Way, just a wonderful organization, and their logo is Get Connected, Get Help, and we really appreciate working with them. Salvation Army, they provide a lot of support as well. Adult programs, emergency assistance, family counseling, youth services, and they help with housing issues as well. Whoops. St. Clair County Department of Veteran Affairs. Veterans are so important. It's so important that we provide support to the veterans. Mental health, There's military and veteran discounts, rehab available at the Port Huron office. Nutritional support, Mid-City Nutrition, and the Blue Water Community Depot. Blue Water Action Plan. So Blue Water Action Plan health programs, food assistance, hoop houses for health, and they assist with personal hygiene issues as well. St. Clair County Commission on Aging, they look after the Meals on Wheels, which is a great program, in-home services and transportation. I'm going to talk a little bit about how an organization such as the one that I work for works. We are very blessed to have a continuum of care. As I mentioned earlier, it's really important because then a patient can be with us for the duration of a disease process. So private duty, as I mentioned earlier, that's the extra help, hygiene support, perhaps some housekeeping, companionship that is not provided by skilled home care benefit. Home health care could be anything from someone that's recovering from hip surgery to a new diabetic, someone with a cardiac issue, anyone that's been discharged from a skilled nursing facility or a hospital really should have home care support to make sure that they get home safely and can stay home or to an assisted living or senior community. The next service that we offer, and we're so proud of this, is hospice in the community. So hospice is not a place, it's a wonderful service of support. And we provide that support wherever the patient may live, may reside. Even if they go to stay with a family member, they stay in their own home, assisted living, independent living, wherever they may be. If they need to move somewhere else, we have the most beautiful, and I'm going to show you a picture in a second here. So home care, again, cardiac care, Blue Water Hospice Community. Now here's a picture of our beautiful Blue Water Hospice home. Of course, we have staff there 24 hours a day. Family and friends, depending on what's going on with COVID-19, can spend quality time with their loved one. All of the rooms are very peaceful and calm, and they overlook our pond, a 2.5 acre pond. So it's a beautiful, serene, calming location. And again, we emphasize dignity and privacy, and it's for the end of life care. So I want to just recap. So again, if you're having a virtual visit with a physician, with any kind of health resource through a video chat or phone call, one thing that's very important to remember is to make sure you have everything prepared. Have your health card handy, your identification with a picture because they may want to see that, a list of your medications. If it's a new physician that you're talking to for the first time, make sure that you have your medical history available, any allergies. If you could take your vital signs, have your blood pressure and weight available for them, that would be very beneficial to you and the physician. And any questions that you may have for them, what symptoms you could be experiencing. And it's just really important to have that ahead of time when you're talking to anyone. And again, we want to provide this care at home, especially during this time, to reduce exposure, reduce unnecessary rehospitalizations, and make sure that our community is safe and they get the healthcare resources that they deserve. Quality care, timely care, and care that is providing the patient with dignity, privacy, and support. So I want to provide my phone number. If anyone has any questions, if there's something I didn't talk about today, if you ever have a question you want to ask, my phone number is 810-334-5594, or you can reach me via email, jennifer.hayes, Hayes, at vnabwh.com, and I am happy to answer any questions that anyone may have. If you need support, I am a social worker, and I have over 20 years experience in home health care and hospice. And as I mentioned earlier, our organization has been providing support to the community since 1952. And so we really know what we're doing. And our providers, which is our nurses, therapists, home health aides, they all live in the community where they service their patients. And we just want to provide ongoing support. So thank you for your time. Does anyone have any questions?
Hi, Jennifer. This is John Watt. I got a couple
Hi,
quick
John.
questions. How are you doing?
Good. How are you doing?
Good. Hey, as far as if I'm taking care of my mother right now, she's 86 years old, and if I just
Okay.
wanted to have personal hygiene to help shower twice, 2 or 3 times a week, could I utilize VNA for that?
Yes, absolutely you can. Absolutely. We provide showering assistance, hygiene, and also companionship. If she needs a little housekeeping done, we can provide that as well.
Okay. And the other thing is, what is a portable diagnostic provider? What is that?
So depending where the patient resides, there are portable devices such as x-rays or EKG machines that
Oh, okay. I gotcha. Okay.
into the home. And then there's so many other things. If someone has diabetes, a glucose monitor is considered a portable device as well.
Gotcha. Okay. Thank you very much.
You're welcome. And I relate as well. So not only do I live and breathe to help people find the resources they need in home health care, I also have an aged mother and she's 89 and so I get those resources for her as well. So I understand where people are coming from and getting that support they need for their loved ones.
Gotcha. Thank you so much.
Call me anytime, John.
Okay.
John, I remember taking care of my mom also, and I know Thelma took care of her mom, and I used a lot of resources and asked a lot of questions, and it was helpful to me with chamber networking to reach out to these folks for the information, because you've never taken care of your mom before. So quite often I didn't even know the questions to ask. And that's where people like Jenny and Angela are priceless for us, just to be able to ask the questions that seem crazy, like, oh my gosh, how am I going to do this? And Meals on Wheels is a blessing for our county. They are amazing at the Council on Aging. It's just, they are a huge gift for us. Huge.
Definitely.
Yeah. We have a couple of comments coming in, and that's a good thing. So you guys can see. This is being recorded. As I said at the beginning, this will be posted on the Chamber Facebook page as well as on the Chamber website on the Lunch and Learn page. And so we often see that people come back later to watch these, which is nice. But yeah, that was awesome, Jenny. So
Thank you.
complete. Now that hospice.
Joyce, not to interrupt you, but I want to also say, Jennifer, I thought the PowerPoint in your presentation was outstanding. I think you put a lot of resources into it. As Joyce says, people go back and they view them, but I think this is one that will promote as well a couple of different times because the value of it. Most of us are starting to take care of our parents, and with all the stress going on, people don't really know where to turn. And I think this would be a great start for them. And then they
Thank
can
you
reach
so
out.
much. We're happy to provide this support to you. And Angela and I, we understand personally, what people are going through.
Yep. And Jenny, I just wanted to ask a question too. You made reference to some grants and things that are available for families for some limited resources or support. Can you speak a little bit to that? What would the process be if, you know, someone is uninsured or funded for those types of things?
Sure. So we do receive grants. We have grant availability. And so we receive grants through the United Way for home health and from United Way for special care services and also for the home care for hospice home room and board. And it can be a little confusing, but I just want people to, the one big, it's a financial assessment that we have to do. So the easiest way is to tell you just to call us and we will help work everyone through this. 810-984-4131. It's individually based. And I just want to say that this is for St. Clair County residents. And there are some age requirements, financial assessment needs to be done, but we can work with individuals to get this done. And this isn't a charity. This isn't, I don't want individuals to think of it as a charity. This is something that you deserve. You qualify for this, and this is put in place for people to utilize. We want to keep people safe in their homes as long as possible. And it can be daunting for some people. There are also money and millage dollars for people, but just let us help you with all of this because we don't want anyone to think, oh, I don't know where to turn. I don't know how to fill out the paperwork and just let it go. We don't want that to happen. So just call our main number and we have people available that can assist with all of this. It's a very giving community and we all work together to provide support. And that's why we wanted to talk today so that people are aware that these supports are out there, these resources.
The United Way is a huge resource also. They have
Yes.
the medical loan closet and all sorts of different things. Food.
I've seen the closet. I've seen the closet. They have a lot of donations. So if people are listening, you know, if they do have someone pass away or they have hospital bed, wheelchair, walker, please donate to their special closet so that other people can utilize it. And just know that that equipment is there and we can help get that for you too.
Something I learned a long time ago when I was taking care of my mom was that, you know, toilet, chair, and all that, if it's prescribed by her doctor, you get a discount when you purchase it. And no one really tells you that. So that was a huge bonus for us.
Excellent. Excellent.
Yeah. Anybody else have anything for our Jenny? She is now our Jenny.
Aw, thank you. And I want to be your Jenny. So I'm here as a resource. Call me anytime, email me. We're here to support the community. We're a not-for-profit organization. So we're not in this to make millions of dollars. We're just here to support the community and do it right, provide quality care.
This is awesome. Thank you so much, Jenny. Thank you.
Thank you.
Angela, and everybody, you have a great day, and we'll see everybody soon.